80 to 90% of the vitamin D necessary for health is produced in the skin. Those who are regularly in the sun can ensure sufficient vitamin D production, at least from April to September. Welcome to In Health and Beauty channel. Please, don't forget to subscribe to our channel and hit the bell button to be notified as soon as we upload new videos. The important thing here is exposing the face and hands to sunlight for 5 to 25 minutes uncovered several times a week. The duration depends on the skin type, the month, the time of day. Several short sunbaths are recommended. As a rule, everyday activities such as commuting to work or school or other outdoor activities are sufficient. Avoid sunburn, but do not use sunscreen. These reduce the synthesis of vitamin D. What is vitamin D deficiency? The human body needs some substances that it cannot produce itself or cannot produce on its own. Among other things, this includes vitamins. One group of these are the calciferols. They are also known as vitamin D. Humans can only produce these substances when they are directly exposed to the UVB radiation of sunlight. In northern regions, people therefore often lack vitamin D in the winter months, between October and April, for example. With a vitamin D deficiency, the body cannot absorb calcium from food. This is why a vitamin D deficiency leads to decalcification and ultimately softening the bones. What does cause the vitamin D deficiency? In winter, in our latitudes, there is not enough sunlight to produce enough vitamin D. However, the body can store it, which contributes to a certain extent to the supply. The prerequisite is that you have been in the sun enough in summer. How long these reservoirs remain full and whether they will last until spring, there are different statements. What are the symptoms of a vitamin D deficiency? Doctors speak of vitamin D deficiency when people have not been supplied with vitamin D for a long time, that they show some of the following symptoms. Bone pain. Deformations of the bones, especially the ribs, legs and spine. Broken bones. Swelling at the junction of cartilage and bone. Softening the back of the head. Delayed closing the fontanelle in young children. Muscle weakness. Susceptibility to infections. Hit the like button if you like our content. Those who rarely spend time outdoors have a higher risk of vitamin D deficiency. This mainly affects immobile, care-dependent and very old people, as well as people with dark skin and people who are only covered in the open air for cultural or religious reasons. People who live or work in bright rooms can also be affected because panes of glass keep UV radiation out. People with dark skin, they need more UV light. Old people, with increasing age, the body produces less vitamin D. Obese people, presumably because of the higher absorption of vitamin D in adipose tissue. Pregnant women. Newborn. In the first year of life, you will always receive vitamin D supplements to prevent rickets. People who wear full-body clothing for cultural or religious reasons. People who are tied to the house because of illness or need of care and who avoid the sun. Patients with chronic kidney failure or chronic liver disease. How is vitamin D deficiency diagnosed? There are several diagnostic methods available to doctors who suspect a vitamin D deficiency. This includes the questioning about the occurrence of typical symptoms, habits such as eating and exercising in the fresh air, taking medication, illnesses in the family. The physical exam. Blood collection and laboratory examination. An X-ray of the hand in children to identify possible deformation of the joints. How do you treat vitamin D deficiency? A proven vitamin D deficiency that cannot be compensated by sunlight and diet is treated with tablets. Most patients receive calcium at the same time.